There are so many details to Medicare that it can make for a lot of questions. This show is dedicated to answering those Medicare questions one by one and serving as your resource in the modern Medicare world. This is Medicare Made Simple with Kevin Geiger.
Welcome to Medicare Made Simple with Kevin Geiger of Carolina Medicare. I'm Mark Elliott, and I'm sure you're asking yourself, why does Kevin want to do a show entirely on Medicare? Well, I can tell you for one reason is what's going on right now. It's that open enrollment period. The annual election period is coming up for if you have Medicare Advantage plans. It's a time to change. You can go Medicare Advantage to Medicare Supplements. What about Part D? Do you have prescription drugs? Well, this is your opportunity from October 15th through December 7th to make some changes. So, Kevin, let's get into it. Welcome to the program.
I appreciate it. It's been a crazy week. We're starting to get a lot of phone calls coming in right now because we got the open enrollment coming up right now. But anyways, my name is Kevin Geiger. I'm the owner of Carolina Medicare. We are the Low Country's fully independent Medicare advisory firm, which basically means that we're free of any influence from any insurance carrier because our job is to find the right plan for you, and we look at all insurance carriers that are available out there. Our service is always free to our clients, and our goal is basically to guide you through this Medicare maze, as we call it, because let's face it, when it comes to Medicare, nothing is easy. So if we can offer our services to help you with that, that's what we're here for. And so if you'd like to give us a call, our number is 843-868-MEDI, which is 6334, or go to our website at carolinamedicare.com. And Mark, also, we put on a lot of workshops, especially as things are kind of calming down now. We have these workshops set up to basically talk about everything around Medicare. We do this all through our non-for-profit Retirement Focus Academy. And the idea behind this is really just educate people without them feeling like they're being sold anything, so they can kind of go into retirement and through retirement without any stress and understanding they're making educated decisions. And that website for that is retirementfocusacademy.com. Again, retirementfocusacademy.com. And that is also a free charge to anyone that wants to go.
So, carolinamedicare.com to find out more about Kevin and the team. And you can also, with those workshops, you want to learn more, actually go to a workshop. There's no cost to you. It's retirementfocusacademy.com. Carolina Medicare serving the Low Country, Charleston area, Myrtle Beach, really the entire state of South Carolina. October 15th through December 7th. That's coming this week. We are getting underway for the annual election period or open enrollment as you look at it. Why should people pay attention to this time period every single year?
Well, Mark, I know we keep talking about this week by week, but I always say we got to beat a dead horse sometimes. And this is the most important time for anyone that's currently on Medicare. This is the time when you've got to evaluate your current plans. Last month, you got your, what we call the ANARC, which is the Annual Notice of Change. Now, people are going, well, I got that letter in the mail, but I threw it away. Well, the problem is you got to look at that. There's so many things changing inside these plans nowadays, whether your doctors are in the current network going forward into 2021, or are your drugs going to be covered under your current drug plan that you're currently on going into 2021? There's so many things that need to be done. And unfortunately, we have what we call 7 weeks of madness going on for us right now. There's so many things going on, and we have so many people that we reach out to with our current clients and new clients that call in to make sure that we're doing right for them, evaluating their current plan and helping them make a change. And I want to point this out. What people don't realize is when we do make these changes, let's say we moved them from one Advantage plan to another Advantage plan, we don't get paid anything extra. We still get paid the same, what I call a annual commission or, thing that they pay us to maintain the plan. We get paid the same thing whether we keep you in the plan or move you. So it's always in our best interest for us to make sure we're doing right for our client. And this is why we're so busy at this time of year, to make sure that plan is right for our clients. Because at the end of the day, we want them to refer us out to other people. We want them to realize that we're always looking out for them. And that's why this time of year is so busy for us.
Yeah, and you're not paying Kevin. It's the insurance companies that are paying Kevin. He's independent. And you think of somebody that would be captive, then they work for a specific company. Kevin is independent, which kind of opens up the whole smorgasbord of options available to you, to him, to do the best research and find what makes the most sense for you. This time period, when it comes to the annual election period, the open enrollment for Medicare Advantage, and for Part D. So if you don't have Medicare Advantage, you've got Medicare supplements, you say, well, that's not me, it's Medicare Advantage. Well, no, if you got Part D, it is. And you could go Medicare supplements to Medicare Advantage or Medicare Advantage to Medicare supplements. That's why this is so confusing. It's why Kevin has Retirement Focus Academy and puts on the workshops to help you understand all of this. That's retirementfocusacademy.com. This time period for you in this health world of Medicare is real similar to probably a CPA on April 15th, isn't it?
It is. You think for them, it starts in January all the way up to April 15th. This is go time for them. They have a deadline. Well, our deadline is December 7th. And there's a lot of stuff that has to be done by then. There's a lot of reviews we have to do with current clients. There's a lot of new people that reach into us and say, hey, I don't know if I'm doing the right things. Or am I in the right plan going forward? I don't know. I'm clueless. I'm finally admitting to the fact that I need help. And, I always joke around with people. I go, people hate to admit that they need help. I think more now today than ever, to say, hey, I realize I've hit my limit. I'll give you an example of that where, when we ripped out our deck behind our house, we decided we wanted to put pavers in. We decided we're going to take this on our own. So we tore the deck out, did a great job in that, called the college junk guys to come pick it up. And I was like, man, this is great. We saved a ton of money. Now all of a sudden we started trying to do the base to the whole thing and realized I've met my match. This is not for me. And so sure enough, I had to reach out to a professional, someone that really knew what they were doing to come out to finish the project. Well, it's the same thing with Medicare. You might have done something for yourself, last year or a couple years ago, and now you're finally willing to admit that maybe it's time to talk to someone to make sure that plan is still right. And there's situations where I've sat down with a Mark and I said, you know what? You're good. What you did was smart. You made the right decisions. I think it's the same. The plan you're in right now, you should just keep it. I think it's the right decision, and that's fine. And at the end of the day, it's peaceful mind for me knowing that I help them along, even if they don't need to make any changes. That's fine. That's what we're here for.
And reach out to Kevin if you have questions about this, because this can get very confusing, which is why the show is called Medicare Made Simple. And it's made simple because you just call Kevin. He explains it to you. It's 843-868-MEDI, which is 6334, 843-868-6334. And remember, the services at Carolina Medicare, they're always free to you. Kevin's goal is to just guide you through this Medicare maze. 843-868-MEDI, which is 6334. Glad you're with us today for Medicare Made Simple with Kevin Geiger of Carolina Medicare. I'm Mark Elliott. You can always go to the website carolinamedicare.com as well to find out more. And this is the open enrollment called the Annual Election Period, October 15th through December 7th. Are Medicare folks doing right for themselves every year during these enrollment periods, would you say?
No, and I know we always talk about it. People are creatures of habit. They just don't like to make change. The idea they feel like, well, this plan did right for me last year or this current year, for example, and they don't do anything about it, and they don't make changes to that, and they don't even look at that annual notice of change. And I keep saying that, annual notice of change, because people need to realize that's an important document that you have to start looking at.
You're saying that is more important, the annual notice of change, than the thing I get from, some stock I have or something, that prospectus that I've never looked at once. The annual notice of change I should look at, is what you're saying.
Oh gosh, I mean that prospectus, I think they purposely put it together to be 3,000 pages long just to confuse the heck out of you. Well, this annual notice of change is actually kind of easy to understand because they're telling you what's changing, what drugs are not going to be covered for next year, what networks are going to change with your doctors and stuff like that. They're going to basically point this stuff out to you. But if you don't understand it, that's what we're here for. For us to sit down with you to understand that stuff. And people just, they're just creatures of habits. They go to the same restaurant. They go to the same vacation spot. They got a timeshare, right? So they're going there every year for the last 35 years. But when it comes to your health insurance, which is and now your Medicare, you've got to start evaluating things because those nice trips you want to go on, even if it's to your timeshare you've been going to for the last 30 years, it might put a hamper to make you covering the next flight to go there because you've ended up having to cover more medical costs this year. Don't do that. Make sure that you're being proactive. Plans have changed quite a bit. The Medicare Advantage plans are getting very competitive right now. I know just by looking at the plans from last year, a lot has changed. If you have a plan that's at least 3 years old, I guarantee you there's better options out there right now, better bells and whistles I like to call it, and in some cases cheaper. And you can even stay with the same carrier. That's the best part. Some people that just like their carrier, you might realize that there's a better plan inside the same carrier that you could stay with, but will be better for you. So there's things that you should be doing And I always think it's important for people to realize that they've got to look at this stuff. And that's, again, why we're here to help.
So how often, do all these insurance companies change a lot of things during, every single year during this open enrollment period? Or are they just a few minute things here or there, but they could make a big difference? Do they always change?
Yeah. It's a constant change over and over and over, where we're seeing more changes inside these plans. And in some cases, it's for the better. You're seeing plans just getting more competitive. Companies are coming out with new names, right? It's like a cell phone, right? T-Mobile is a service I use, and they keep changing their new plans. Now it's the Magenta plan, and I'm still on the One plan. And they entice you with the new features inside these things. So again, you don't have to change carriers in some cases. You might actually find that there's just a better option inside your current carrier. And it's important to know that. And 6 out of 10 people are currently, if you're people that are on supplement plans or Advantage plans, 6 out of 10 of them are on the Advantage plan. So meaning that 6 out of 10 of you should be looking at what you currently have to make sure that this is still the right plan and get the bells and whistles that are there. If you're going to get something free, why not take advantage of it?
Come in and talk to Kevin. You got questions at Carolina Medicare. There is no cost. 843-868-6334. So how many, give me a percentage. You just said 6 of 10 would be on Medicare Advantage versus Medicare supplements. But if we have Part D, we do have the option to change during this annual election period, open enrollment October 15th through December 7th. So when you think about this, do people always do this every year? It sounds like they should, because things are always changing. But do most people come in and say, hey, this is my open enrollment period. I need to come look at things, see if things have changed. Do I need to change something that on my end? Do most do that, or do they do it every couple of years, or how do you look at that?
Well, when it comes to our current clients, we're automatically doing this with them. We're already reaching out to them to set up, a phone review or an in-person review, things like that. So we're already doing that. And ironically, they end up referring us to their friends a lot of the times, because their friends are not getting that advice. Because again, they signed up on their own, and they're the do-it-yourselfer kind of scenario. So if you're working with us, we're doing it automatically. If you're on your own, I would say maybe you see them looking at this every 2, 3, 4 years, maybe. But in some cases, there's that loyalty to that company, and they feel, well, this plan's good for me, and the same company and plan's still good for my wife. Well, like we could talk about before, in some cases, your wife and yourself and vice versa might be better off being with 2 separate carriers, because the coverage is going to be a better fit for each one of you. So there's a lot of things you got to understand inside these plans that you just aren't looking at. And again, that's why we're here. You give us a call, we're going to go through this stuff with you and make sure that it makes sense for you. And if you have brand loyalty and you just don't want to leave that company, your AARP plan or whatever the case might be, well, let us see if we can find a better solution inside there that'll give you better benefits, better coverage, and maybe save you a few bucks in the process.
Yeah, so you think about this, that it's one of those things that things will change, and they've sent you the annual notice of change, but you may not have looked at it. It sounds to me like you should, because your doctors could have changed, prescription drugs more than likely might have changed. That's really a key. So here's your opportunity. October 15th through December 7th is this annual election period. That's why it's called that. Every year, same dates, October 15th through December 7th, you have this opportunity. You can switch from original Medicare to Medicare Advantage, or you can go Medicare Advantage to Medicare Supplements. You can switch from one Medicare Advantage plan to another. You also can switch from one Part D, which is prescription drugs, to another. This is a huge opportunity for you. And if you don't really know, you're like, how in the world do I figure all of this out? I don't even know all my options. That's why Carolina Medicare and Kevin Geiger are here for you. There is no charge to you from them. If they do something for you and you become a client, the insurance companies are paying Kevin. But he's looking out for you. It's not going to say, ooh, I can make a little bit more if Betty comes in here and I move her to this, I'll make more. That's not how he works. It's about what is the best situation for you, because as he said earlier, he wants referrals, which means he's got to do the right thing for you. What's the best interest for you? That's what Kevin and the team at Carolina Medicare are looking out for. Again, the website is carolinamedicare.com. If you'd like to do a little research on your own, carolinamedicare.com. You can call him, 843-868-MEDI, which is 6334, and there's no cost. Find out where you are. This is a great opportunity for you, and don't miss out on something that next year you go, wow, I should have changed that. That is not even an option this year. I didn't even know it. That's what that annual notice of change is all about, and Carolina Medicare and Kevin Geiger are here to help. 843-868-6334 is the number, 843-868-6334. Back with more right after this. Stay with us. This is Medicare Made Simple with Kevin Geiger of Carolina Medicare.
You're listening to Medicare Made Simple with Kevin Geiger. Open enrollment begins October 15th. What questions do you have about the process? Call 843-868-MEDI.
It's the time of year to review Medicare plans, and the Medicare plan that was right for you last year might not be right for you this year. With so many moving parts, many things can change, and last year's good provider might not be as good in 2020. Coverages, co-pays, prescription formularies. You need somebody you can bring your questions to. Someone independent. Someone who puts your best interests ahead of their own. Let Kevin Geiger of Carolina Medicare be that person. Kevin can help you review your options for 2020. To set up a one-on-one visit, call the office at 843-868-MEDI. That's 843-868-6334. Or sign up for one of Kevin Geiger's upcoming webinars at carolinamedicare.com. That's carolinamedicare.com. Let's get you settled into the right Medicare plan for next year before December 7th rolls around. Kevin Geiger at Carolina Medicare. Call 843-868-MEDI or visit carolinamedicare.com.
You're listening to Medicare Made Simple with Kevin Geiger. Online at carolinamedicare.com.
Welcome back to Medicare Made Simple with Kevin Geiger of Carolina Medicare. Don't forget this. If you have questions about this open enrollment period, the annual election period, which is October 15th through December 7th, the dates are the same every single year. Kevin's services for you at Carolina Medicare cost you absolutely nothing. Can he help you? And he might, as he said before on this program. Hey, you're doing a great job. You're exactly where you need to be. Keep doing it. You're fine. You want to come back next year and check it again? I'll be happy to help you. But you're doing the right thing. But if you're not doing the right thing, I think you would rather know sooner rather than later. So there is no cost to talk with Kevin and the team at Carolina Medicare. You have questions, it's 843-868-MEDI. 6334. That's 843-868-6334. And of course, you can always go to the website to find out more, carolinamedicare.com. We just talked about the annual notice of change that a lot of people don't even look at it, but that could be changing doctors. It doesn't happen as often, I suppose, as changing the drug options that you have available. We talked about that annual notice of change before the break. How important is October 15th through December 7th, this annual election period, to Medicare recipients or beneficiaries, or however you want to look at it?
Well, Mark, that's a good question, because it's going to sound like for at least the next month or so we're going to be beating a dead horse here, but this is the most important time for you. This is the most exciting time for us and the busiest times, because right now, you're getting that annual notice of change. And again, we talked about this before the break. You're getting this letter. You've already gotten it already, probably last month. You've got to start looking at this stuff to see what's changing inside your plan, because this stuff is going to make a drastic difference in some cases to how your coverage is going to be for your current situation going into 2021. So if you haven't looked at it, pull that thing out, give us a call. We'll sit down with you or even talk to you over the phone and kind of go over what your current changes are, figuring out what your current health scenario is, your current prescription drugs you're on, and then we can evaluate to make sure that all makes sense for you going into next year. I don't know about you, Mark, but if I can have a little peace to myself knowing that, hey, I made the right decision. I called Kevin and his team to find out, and sure enough, I found out it was going to cost me a good chunk of change going into next year, but he found me the right plan that's going to save me more money going into next year. And hey, more bells and whistles to it. There's nothing wrong with getting a little a free lunch, as I always say. If someone's willing to chip in for a free lunch or dessert or something like that, don't turn them down. Well, it's the same thing. This is what we're offering. We're offering free service to go through this stuff to make sure that you are doing the right things. And this is why it's such a busy time for us at this time of year.
Yeah, absolutely. 843-868-6334, the number 843-868-6334. If you have questions or concerns, hey, this open enrollment, I'm not even sure what I should be looking at. I got an annual notice of change. Don't even know what that means. I need some help and guidance. That's what the team at Carolina Medicare and Kevin Geiger are here to do for you. During the break, Kevin, we were talking about some of the phone calls that you received after our last show, and you wanted to bring something up from that.
Yeah, that's actually a good thing. So we had 9 calls last week, and one of the calls kind of struck me. And, they brought up, they said, all you keep talking about is a lot about the Advantage plans, and not talking so much about the supplement plans. And so I kind of wanted to point this out. So a couple things. 62% of the people that have a supplement plan or an Advantage plan, 62% of them are on the Advantage plan, first and foremost. So, not that we cater to it, we do everything. Everything around Medicare we're doing. We're even helping people that need to get state assistance to help cover the extra, cost or co-payments and everything else inside their Advantage plan. We're helping them do all that stuff. So we do everything around Medicare. So I wanted to point that out. But secondly, right now, since it's open enrollment, the biggest changes going on right now happen to be in the Advantage plans and the drug plans. So this is why we focus so much attention on that. But I wanted to point that out, that we do everything. And this is what we're able to do and cover the stuff. And if you're currently in a supplement plan, not a bad idea to reach out to us to say, hey, I'm in that K plan that you were talking about in another show. Should I be switching to a better plan or an Advantage plan and things like that? We can evaluate that stuff because we can do that throughout the year. Maybe in some cases you're still healthy. We're doing that underwriting process in order to upgrade your Medicare supplement plan. Maybe it's a good time to look into doing that stuff. So I just want to kind of point that out, that we do everything. We're available to everyone regarding Medicare.
Yeah, so you think about that. Medicare supplements or Medigap, same thing. So get that straight. Medicare supplements, Medigap, basically mean the same thing. They're private health insurance designed to supplement original Medicare, Parts A and B, by filling the gaps in original Medicare coverage. And there are some underwriting things that happen in the Medicare supplement world. Medicare Advantage plan, private health insurance that provides Part A and B coverage and other extras, potentially including dental, vision, and hearing coverage. It's crazy that Medicare, now I'm 60, Kevin, so I know that my vision is not as good as it once was. I know that my hearing is not as good as it once was, yet it's not under just original Medicare. So that's why you look for the supplements and Advantage plans to help cover some of that areas. But in the Medicare Advantage, you don't typically have underwriting. That's just time. There's nothing. If you have a health issue, you can still do things in Medicare Advantage. And that's why it's so important to look at this, because our health changes year to year, month to month, and things happen in our family. I mean, life keeps coming at us. So do you run across people when they come in and sit down with you, they go, boy, Kevin, I thought I already knew. I thought I had a pretty good handle on this, Medicare Advantage plan stuff and Part Ds and all of that, and thought that they were really on top of it. And then they come in and sit down with you and go, wow, I guess I was a little misinformed there.
Yeah, we see that all the time. Everyone, we all like to think that we're doing right for ourselves, that we've went through all the books and looked at every plan that's out there and said, hey, this is the right plan for me. Or in some cases, maybe they just got cheap, as I would say. They decided not to spend the extra money to buy that bells and whistles plan, the one that has the cream of the crop, buying a supplement plan, and they bought a K plan instead of buying the G plan, where K plan is only covering 50% of it versus the G covering all of it. So we run across this all the time where people just aren't looking at what's important to them. And at the end of the day, your healthcare cost in retirement is going to be probably your second most expensive cost that's going to change or alter your retirement and how you're going to perceive, each year going into retirement and what you want to do. I mean, I don't know about you, Mark. When I retire, I want to travel. I want to do things. I want to go and enjoy life, enjoy my grandkids, do all that kind of stuff. That's important for me. But if I have to worry about something that I made a mistake on inside of my insurance, my health insurance plan for my retirement, to make sure that it's not going to alter my retirement savings because I made a mistake. I don't know about you, but that would really hit me hard. So I like to hit home with this and say, there's options out there and what you can do, and whether it's a supplement plan or whether it's an Advantage plan, each one of them work. It's like, for example, I always use the hammer story, right? So you got a screw, you got to screw back into a wall or your couch,
you were going to tear up your porch. You're going to tear up your back porch. And you're going to do it all with a hammer.
Yeah, do it all with a hammer. Sure, a hammer works great. You can kind of pull it all apart, but maybe the circular saw works great. There's all these different tools out there that you could be using. The same thing with Medicare. There's all these different options that are available out there. Doesn't mean one's per se better than the other, for example, because they all do the same things, but there might be little nuances there that can make things easier for you. Maybe make it save money in the end. Those are things you got to start thinking about. And so just like your retirement savings, you got to be thinking down the road. How can I make this last for my lifetime? If I'm in retirement, I'm thinking to myself, I want to make sure it's lasting 40, 50 years. I might not live that long, but I'd like to know that it's going to last beyond that. Well, the same thing with your health insurance. It's going to affect your retirement savings if you don't make the right decisions today, and that's why we're here.
Yeah, and again, you can go to the website to find out more, carolinamedicare.com, carolinamedicare.com. And Carolina Medicare serving the Lowcountry, Charleston area, Myrtle Beach, really the entire state of South Carolina, carolinamedicare.com. Remember, this is a free service to you, and Kevin's goal is to guide you through this Medicare maze. There's going to be things that you don't know, and what you don't know can cost you some dollars, actually, when it comes to this Medicare world. You can reach Kevin and the team at Carolina Medicare, 843-868-MEDI, which is 6334, 843-868-6334. Glad you're with us today for Medicare Made Simple with Kevin Geiger of Carolina Medicare. I'm Mark Elliott. Remember, Part A in Medicare, Part A covers hospital, skilled nursing facility, hospice, home health. Part B, doctor appointments, outpatient care, occupational, physical therapies. Then you get into the world that we're talking about. Because remember, Part A and B are run by the federal government. Part C and D, these are now offered by private insurance companies. Part C helps cover everything that Medicare Parts A and B cover. It often covers additional services like, as I said, dental, vision, and wellness programs. Part D, prescription drugs. So now instead of the federal government, which runs Part A and B, we get into the private insurance world, really is what it sounds to me like, Kevin, which is why there are so many options. Now, if you're in the Medicare supplement world of the letter alphabet, the K's and G's and all those kind of things, every company offers the exact same things, but your dollar amounts might be different, and you might prefer one company over another, I guess. Medicare Advantage, you got a lot of different options there as well. Maybe wider variety in Medicare Advantage and Medicare supplements?
Yeah. With Medicare Advantage, there's I would say it's a very competitive world. So all the insurance companies are trying to buy up market share. So everyone's going to offer more bells and whistles. And again, people sometimes get too tied up in the extra bonuses they're getting in a plan and not realize that maybe their doctors or prescriptions aren't being covered. So make sure you're first and foremost looking at that. And then you look at the bells and whistles outside of that stuff. So the first thing, drugs, your doctors you're going to, and all that kind of stuff for coverage. That's the most important thing you need to be looking at inside of a plan. And that's what we first look at. And then we look at all the good stuff that comes with it.
Yeah, as we wrap up today's show, again, I always think it's great to talk about your Retirement Focus Academy. It's non-for-profit. You can find out more at retirementfocusacademy.com. Explain that a little bit, if you would.
Sure. So, the story we were talking about before, there's the exact reason why I started this non-for-profit organization last year, because I realized that people just needed to be educated. And so, and they didn't want to feel pressured. They didn't want to feel like they're going to a dinner seminar and someone's going to sell them something. So we created this, and so we cover everything from retirement basics to Medicare, taxes, maximizing on Social Security. We even have a retirement for women, which is actually hosted by my wife, Lauren Geiger, who talks about stuff about retirement on that side of things. So we really keep building, what I was going to say, all these different workshops to really help everyone in the Lowcountry get in and through retirement successfully and educated. That's the most important thing, I think, for anyone going into retirement, is making sure you're doing it right. And that's why we set that up.
So that's carolinamedicare.com for Kevin's company, but Retirement Focus Academy for those workshops. You can find out all the dates and where these events are, retirementfocusacademy.com. Think about this, because nobody, as we've said a lot on this program, nobody really likes to change. It's a hassle to make changes, right? That's why you don't shop car insurance or you don't shop cell phones to try to get the best deal, because you've got one and it's just a headache and I don't want to deal with it. Well, here's the deal. When you have your Medicare plan and you don't shop for a better situation here either, you might be costing yourself some money, and you might be costing yourself the coverage that you actually need. Let Kevin do the shopping for you. If there is a better situation for you, Kevin and the team at Carolina Medicare will find it. But he can't do that if you don't give him a call. 843-868-MEDI, which is 6334, 843-868-6334. Again, the services at Carolina Medicare are always free to their clients. Kevin is here to guide you through this Medicare maze. Again, the number 843-868-MEDI, 6334. Kevin, enjoyed it? We're going to be back again next week covering a lot of the same topics, but we'll add some new stuff in as well. Have a great week. We'll do it again next week.
All right, sounds good. Take care, Mark. Take care, y'all.
This has been Medicare Made Simple with Kevin Geiger. To talk with Kevin, call 843-868-MEDI. That's 843-868-6334. Kevin is also online with your resource on all things Medicare. Visit carolinamedicare.com.